Hello, you're watching Sightline on MNB World, and today in our studio we have UNICEF's representative in Mongolia, Mr. Evariste Kouassi-Komlan. Hello.
Hello.
Hello, nice to meet you. Thank you for accepting our invitation.
Thanks. It's a pleasure to be here today.
I would like to start our interview with Mongolia's new country program that was adopted by the UNICEF in late 2020, and it will be implemented between 23 through 27. And what are the main areas of focus of the new country program?
I just want to thank the Ministry of Foreign Affairs first for the contribution and also the collaborative work that they have done, bringing all the ministry together through a whole consultative process to get this new country program approved by the executive board. It has been a long consultation process with young people in the country, with adolescents, with civil society, including private sector and the government official that came up with those this package of the new country program 2023-2027. It will drive our new country program, which is totally aligned with our new strategic plan and also aligned with the UN framework in Mongolia that also is, is going till 2027. So there's a few highlights on this in this new country program. One is health, particularly in health. Our focus will be how we strengthen the health system. We will be supporting the Ministry of Health to strengthen the health system. The primary health care will be one of our key attention. And this also has few components. One is related to earlier detection of the children in terms of malformation, disease, malnutrition, and also many other cardiovascular related diseases as well. And then the second one in health is vaccination. Like we have done during the pandemic. COVID vaccination, hugely import and also distribution with support with Ministry of Health in the country. Will continue the vaccination, the routine vaccination. Actually, we are working hard to bring more measles vaccine in the country because of measles outbreak in many other countries. We want to prevent that. In Mongolia, vaccination is one of the key areas that we'll be focused on. Malnutrition is one of the areas we have seen over the past years that the lack of vitamin, also vitamin D deficiency in the country is high. So we'll be working on that, including how we improve the school meals for the children. And then the last component of health, which is heavily our attention, is how we work on rheumatic disease for the prevention of cardiovascular disease will be one of the key areas. The second pillar of our work is education. And education will be supporting again the Ministry of Health on their effort to make sure that every child go to school and then improve the quality of education, including the content. The third pillar is child protection. And we have seen violence has increased in the household, online abuse or grooming has increased as well. We want to make sure there's a proper capacity building at all levels, basically to address that. That will include also mental health issue, which has increased during the pandemic. And we want to have a capacity of, civil servants, nurses, and people reinforced to address mental health issue. And then the fourth pillar is water and sanitation and climate change. And one of the key things that we'll be working for many years is how we reduce indoor air pollution. And we have been working very, very hard with many partners, including financing institutions, and how we can bring technology to the household to improve indoor air quality.
I see.
Exactly.
We can talk about different pillars separately. And one of the important focus you just mentioned, it is a child protection. And in your recent interviews, we learned that around $60 million will be invested into Mongolia during this period. And what kind of concrete actions will be taken during these 4 years?
Just to add few components after water and sanitation and climate change. The water and sanitation has one component, which is the sanitation component, bringing sanitation facility close to the household, improving sanitation in healthcare facility, and then in the school will be one of the key components, and also the data. We want to have more data on the children, the situation of the children related to child rights issues. Do you know that the Convention of the Child Rights has 54 key articles, and those articles need to be reevaluated this year, and we'll be putting more emphasis on those as well during this year. But now, for the 60 million, some of the concrete action, I think one is basically each of the money will be assigned to each of the components. For example, most intervention on vaccination will be key, bringing routine immunization vaccine here in Mongolia. And then the second one is education will be one of the big components related to our intervention. And then a sanitation facility and water facility in school, in healthcare facility will be some of the components of the 60 million that will be using to support Mongolia government in many different ways.
Recently, the outcomes of the 2018 to 2023 project titled Reducing Impacts of Air Pollution on Child and Maternal Health was organized. And what was the main outcomes of this project for the last 5 years? Yeah.
A few days ago, I went to a field visit with the Minister of Foreign Affairs in Bayan, where this program has started. And you can see a huge improvement in terms of how we can monitor the water quality in the city. And this intervention helped basically to understand how the pollution in any city operates, right? So we have put some of the devices there to analyze the water, the air quality in a city. And linked to that, we have developed some of the small device for the household to use to reduce indoor air pollution. And in some of the schools, we have put some ventilation system, which was not there before, to improve also the ventilation system and have clean air in a school setting. In addition to that, we have also provided some of the sensor in terms of, to measure air quality inside the kindergarten, the school, so that it can build awareness for the children on the situation of the air pollution that they are living in. So it was very important. Some of the general outcome we have seen compared to previous year that household living in area where we have what we call the cooking, heating, insulation product, we call it chip, that we have installed in many gear. Household living that have a better what we call respiratory capacity than household who are not living in using those chip, for example, which is one of the significant results. Knowing that, and family or women living in those in the cheap care house have a better capacity to have a good pregnancy compared to those who are not living in the area where you have cheap or clean air, for example. Many studies have shown that breathing polluted air has a huge impact on many things, including lung. And the latest research that was shared by London School and many other organizations showing that breathing air pollution activates some of cancer cell in the lungs. So we need to do as much as possible to reduce children breathing polluted air. And this is one of the campaigns that we have orchestrated to this program that has been funded by the Swiss Development Corporation. Many outcomes, because we have done more or less 8 research, not only on air pollution, but also the contamination through the blood, like heavy metal in the blood of the children. We have seen that. We have seen how some of the cheap product that we develop performing in different conditions, for example, which basically inform the way that you can switch it off, you can save energy in the household. Many research have been done, and we are very grateful for the Swiss Development Corporation to provide this support so that we can have a good result to this program. We have done a study also on how many days any workers, including the private sector, are losing a year through air, polluted air. It's a huge.
Yes.
So we need to work collectively, and it's something that UNICEF and many our partners are talking about. Once summer or spring come, people ignore totally that the next winter will be hard for the children.
Yes, exactly.
So I think this is a time that we need to prevent, start preventing that, putting a system in place to prevent that. Children will not have a harsh winter because of the pollution, because of the air pollution they will be breathing into their lung. So this program was very instrumental to know many factors of the indoor air pollution and how we can develop the strategy to do that. One message I just want to share with many partners watching this, like, it's time now to invest for the next winter so that we cannot increase the exposure for the children for more disease, including cancer disease for the children in this country.
Talking about the pollution, we cannot leave water issue also. And even though the water issue wasn't a huge problem for Mongolia for the last 20 decades, but due to the desertification and climate change, in some regions it's already becoming a huge emerging issue. And what kind of activities UNICEF implements in the terms of water quality and water access in Mongolia?
So we have done a lot of work in terms of increasing access to the many families, access to water in the country, and this has been remarkable in different ways. And we know that the next generation of most of the conflict will happen when herders and humans will be fighting for water, basically.
Yes.
And it's why we need to work hard with many partners, including government, to make sure that where herder community are settled, we increase the access for them. I think it's one of our key main area for new country program, 2023-2027, to have more water system available to many community. But it's not only the water. The Sustainable Development Goal and goal number 6, which is related to safe water, has totally changed the ball game. That implies to have more, water more clean. And they call it safe water.
Yes, more clean, more safe.
More safe water. And this is where the challenge is. And we have done a study with Water Resource Commission in Mongolia in 9 provinces. And the situation of water quality is not as we are expected. We are expecting. And then the challenge is most of them are contaminated. And I think this needs a new process to get there. And this process we are working on with local government, many local government in many cities, to improve their filtration system, to reduce some of the heavy metal basically in water so that those water can be more drinkable. We cannot achieve SDGs 6 particularly if you don't improve the water quality in most of the provinces. This has to be a collective effort, a new technology, because those technologies have been used before and not well defined to address water quality issue because of the heavy metal, the contamination that we have seen in some of the water in the country. So huge effort need to be done, and we'll be monitoring that, and we'll be working closely with local government, all of them, to make sure that we have a system, we have process in place to inform them, and also make sure when we have available resources to have a local government budget to put the system in place to improve the water quality in all those provinces.
And talking about the water quality, especially in terms of Ulaanbaatar, there's a lot of gare areas, and people living in those neighborhoods, they usually take their drinking water from the ground well. And is there any studies or research on Ulaanbaatar city's water quality?
This many research has been done, and I'm very grateful for many partners, including Millennium Challenge, that they are constructing a new water supply system that will supply the city, which is a very good improvement. But when you go to the area, you see a totally different facet of the situation. Saturday, I was in one of the Gare area, and I see also that's a smart water that UNICEF has constructed before, because the pipe is not going to those areas. The water supply pipe is not going to every area, any household. So those smart water kiosks are very instrumental to provide water to those communities, but we need to go beyond because of the Sustainable Development Goal, which aim to have, for each household to have a pipe in the household. So which is the next step, and we'll be working with the municipality and utility in Uluwambata to make sure that we support some of the components of the intervention. Related to that also is when you have a Gare area, you do have wells, but you have sanitation facilities. They are both cooperating in the same compound. And I think the challenge we have is like, we need to make sure that they fulfill some of the minimum distance to avoid contamination. If not, the well will be contaminated by the pit latrine. So those efforts that we need to make, currently, and we had a discussion with the Minister of Construction as well as how we can bring some of cutting-edge technology, new technology, to help those areas to make sure that we contain the sanitation component, to have more modern sanitation facility that will basically prevent the contamination of the well. So those are some of the program that we'll be working on in the 2023-2027 country program. And I'm very happy that the many ministries are basically open and very supportive of this program, and we'll be working together with them.
During the last couple of years, due to the COVID-19 pandemic, the international community has suffered a lot, including there was a lot of school closures, and major agencies like United Nations, ADB, McKinsey report about the school losses, learning losses in school children. And is there any evaluation like status of Mongolia in terms of learning losses and compared to other Asian countries?
UNICEF had done a study some time ago during the pandemic in 2021, and we identified 200 days of school loss, which is huge. Is totally bringing some
One
of the
school year, almost.
Some of the capacity or the grade of the school, the loss is very huge. It's like 3 years loss that we have observed also in Mongolia, and the quality of education has totally reduced based on the COVID-19. But it's not only Mongolia. We commend Mongolia because earlier on they have put a quick measure basically to ensure that the vaccine is available in the country, and then the children going to school very quick. But at the same time, the education system was not so quick to cope with the situation. So that creates a lot of loss, education loss that we need to recover. And Minister of Education, ourselves, and many partners, quickly we developed many programs, many tools like online education, tablet for the teachers, radio, digital radio that basically reach many households to start coping up with the loss that they have had during the pandemic. But still a lot to be done because COVID-19 had put a lot of not only the students but also teachers in a very difficult situation, while some of them, they don't know how to use a laptop.
Maybe in rural areas.
In rural areas, and then they need to adapt quickly and then have those kind of knowledge. So this also creates a gap in terms of how to transmit the education for the children. So those things has been mastered during the COVID, and to prevent the next pandemic to happen, the same thing, we need to be prepared, and we need to better support the Ministry of Education through the online system that might be very robust now, and have more internet connection with a good speed for the school, and making sure that all those means are available 24 hours and good monitoring system in place, so that we can basically reduce. And some of the countries have taken a lot of good measures to reduce learning loss, and I think we might learn a lot for those countries basically in the year to come, and making sure that we we go very quickly in the education system.
Talking about the activities conducted in the child mortality rate, in decreasing child mortality rate, we just learned that child mortality rate in Mongolia falls by 4 to 5% each year. And it was a study and survey by the UN. And in your opinion, what kind of measures, maybe from the government or from the state organization, should be taken in order to increase this percentage more?
First of all, I just want to commend the government of Mongolia because, reducing this rate by 4.11% every year is huge compared to many countries where those changes are not happening. I think 2020, 2021 reduced, and then 2021, 2022, a huge reduction as well. So we are above some of the countries that we have, in this region, which is very commendable for us, but also we are lagging behind, some of the model countries.
Developing countries.
Developing countries, what you want to be. And so it's where a lot of effort needs to be done in the health sector. So as we have been plateauing for many years, I'll say like 4.5, 4.1% is not a very big deal in terms of reduction, but we are plateauing for many years till 15.2 per thousand, life. But we need to go very quickly if you want to be compared like Japan or South Korea or many countries. So fewer intervention for us might be necessary. I think we need to also, put a lot of energy on skill delivery to have those people who are delivering have a good skill, basically, for delivery. The second one is the prevention measure. We have seen also that anemia, malnutrition is becoming a huge cause of, those under 5 mortality as well. And then we have also noticed that if the malformation is not detected in the womb,
in the early stage.
In the early stage, it can have a consequence when the children is born. So it's why we are working with the Ministry of Health, like I say, in our program on earlier detection from the womb till the children is born for the first 3 years, so that we can monitor to see if the heart is well formed, the lungs are working very well. So those are some of the equipment that will be supporting the government, so that the system is placed to monitor those kind of issues, and this will reduce a lot the under-5 mortality in the year to come. But the system is good already, but there's some of the quality components that need to be in place to support this reduction, and this is what we'll be forcing to do with the government, basically, to have this kind of reduction.
Talking about the recent events, just recently the UNICEF Street was opened, and whose initiative it was, to name the street by the UNICEF name?
I think it was fantastic, right, to have a street on the name of UNICEF. I think it's one overall in the world, I would say, to have a street in the name of UNICEF is the recognition of the work that the organization has done here for more than 50 years. It's not because of me, but it's more, all my predecessors, the work that done, the recognition that they have, and also all the staff that are working very hard, for the benefit to make sure that every child in Mongolia live in a clean and safe environment. Every child in Mongolia has opportunity. Every child in Mongolia is well educated. Every child in Mongolia has access to education, or every child in Mongolia overall has well-being. So this comes from the municipality, basically, and we are very happy that the municipality took this decision to name a street on behalf of UNICEF. But I would say that it's not only UNICEF, but it's all the organizations working in Mongolia for the well-being of the children that this street for. Is why we are calling all the partners, institutions, private sector, who have a heart on the children to come and join us, so that we can make district child-friendly streets. And I can see that many partners already are approaching us, say, we want to do something meaningful. Tomorrow I'll be meeting another one. So do something meaningful on the street so that we can make it child-friendly and that many children, a model street, I would say, that many children or many other districts can basically see and duplicate the same thing in other provinces as well.
Thank you very much for providing updates on the latest events about UNICEF activity as well. Today in our interview program, we had Mr. Evariste Kouassi-Komlan, a UNICEF representative in Mongolia. We'll see you next time with more stories and updates. Have a nice evening. Goodbye.